Not all neck humps go away with exercises, massages, osteo or chiro adjustments, or fat loss treatments. Keep watching this video and you will find out the easiest and quickest way to get rid of your neck hump. If you look at different neck humps, you will notice that each has its own structure. One looks like protruded bones, while another looks more like a buildup of soft tissue. All neck humps generally fall into two categories: structural and soft tissue humps. Structural humps are caused by changes in the bones of your spine. A classic example is Dodger's hump. Soft tissue humps are more about fat and soft tissue deposit. One common type is the buffalo hump. The cause of the hump plays a big role in how you treat it. A structural hump won't improve with just a few stretches because it involves bone changes, while a soft tissue hump might not respond to spinal adjustments because it's not about structural alignment, it's about a fat deposit or soft tissue buildup. Let's review the structural humps. This one is a protrusion of the C7 spinous process. The cause can be head-forward posture, whiplash from a car accident or a fall, arthritis, or disc degeneration. It's common in all age groups. The key here is to treat the underlying cause. This includes posture correction, ergonomics adjustment, and treatment of whiplash or arthritis. If you have no contraindications, a cervical orthosis is effective for correcting the protrusion of the C7 spinal process. It really works. It looks like this. I will leave the link below. Please consult with your healthcare provider before using it because it's a powerful tool, and if you don't know how to use it, you can make things complicated. This one is a widow's hump. The cause is osteoporosis. We have vertebral fractures and vertebral collapse here due to osteoporosis, leading to a forward bending spine. It's more common in older adults, especially women. The key here is to manage osteoporosis and increase your bone density. Your family doctor, rheumatologist, or endocrinologist can help you with that. What else can help here? Physical therapy. A physiotherapist can help strengthen your muscles, improve posture, and reduce the forward curvature. Posture training. Being mindful of your posture during daily activities can prevent excessive stress on your spine. I will leave the posture exercise program in the YouTube community tab. Posture training is perfect for all types of neck humps. Regular physical activity, weightlifting, and strength training program can help build and maintain bone density, support your spine, and improve overall posture. I will leave an example of a basic strength training program in the community lab. Diet and supplements. Make sure that your diet is rich in calcium and vitamin D3, as they're crucial for bone health. Talk to your family doctor if you feel that you are deficient in minerals or vitamins. Avoid smoking and limit alcohol. Smoking and excessive alcohol consumption can weaken bones and contribute to bone density loss, increasing the risk of osteoporosis. Mindfulness and stress reduction. These practices can help reduce stress, which may contribute to muscle tension and poor posture. I demonstrated mindful meditation and deep breathing exercises in this video. This is not a widow's hump. It's a postural kyphosis hump. The cause is poor posture. It can be seen in all age groups, but it's most common among teenagers and young adults who sit for a long period of time. This hump is Scheuermann's disease hump or juvenile kyphosis. The exact cause is unknown, but there is an assumption that it relates to a difference in growth rates between the front and back of the spinal vertebrae. This one is a congenital kyphosis hump. The cause is spine malformation. This happens because the vertebra formed abnormally during fetal development. What can be done to correct your kyphosis? Physical therapy. In my opinion, the most effective physiotherapeutic modality to treat structural kyphosis is the Schroth method. I will leave a link below about Schroth. If you don't know what the Schroth method is, and you or your loved ones suffer from structural kyphosis or scoliosis, please make yourself familiar with this method. It is effective. Osteopathic care. Osteopathic practitioners perform spinal adjustments to improve alignment and reduce pressure on the spine and surrounding muscles. This can help decrease pain, improve posture, and enhance spinal mobility. Osteopathy can be effective as an adjunctive modality for all types of kyphosis. Regular osteopathic sessions will help manage both structural and soft tissue humps. Find a local osteopath in your area. If you are located in Calgary, we are happy to help you. OsteoHealth offers a convenient online booking system, free parking, and affordable rates. Book your treatment online and we will help you in the clinic. Regular physical activity or sport. It can be swimming, soccer, tennis, hockey, and others. Yoga and Pilates. Focus on strengthening the core, improving flexibility, enhancing posture. Regular practice can help reduce neck and back pain, improve posture, and increase overall body awareness. Posture training. I will leave the posture exercise program in the YouTube community tab. Posture training is perfect for all types of neck humps. Bracing. For kids, teens, and young adults whose bones are still growing, bracing can be effective. The effectiveness of bracing depends on the severity of the curve, but a well-fitted brace can help control the progression in many cases. There are different types of braces, and your brace must be tailored by your specialist. It can be physio, chiro, or other specialists. Acupuncture helps to reduce pain and inflammation, promote relaxation, and improve overall well-being. Massage therapy helps to relieve muscle tension, improve circulation, and promote relaxation. Cupping helps to reduce myofascial adhesions. Ergonomic adjustments adjust your workstation's ergonomics. Make sure that you use a chair with a proper back support. Your computer screen is at your eye level and you keep your arms and legs bent at 90 degrees. I will leave the ergonomic tips in the community tab. Limit screen time. Reduce time spent on the smartphones or tablets. Take regular breaks. Regular physical checkups for children and teenagers help identify early signs of postural kyphosis. So regular physical checkups help a lot with earlier intervention. Education is important for younger people who spend long hours sitting in school or using computers and smartphones. You cannot imagine how often I find myself preaching the same thing about posture over and over again when I treat young people. It's better to educate your child early to prevent postural kyphosis. This is bacterial disease Hump, or ankylosing spondylitis. The cause is advanced fusion of the spine's vertebra. It's an autoinflammatory condition. The inflammation and subsequent spine fusion lead to a loss of spinal flexibility, causing the spine to curve forward. The key here is inflammation reduction under supervision of your rheumatologist. What else can be done here to improve the condition? Physiotherapy, Schroth method, osteopathic care, physical training, physical exercises, massage, yoga will work well here. Cushing's syndrome hump. It's a buildup of fat between the shoulders at the base of the neck, creating a noticeable hump. Cushing's syndrome is caused by overproduction of cortisol. Obesity-related hump. The presence of the hump is more than a cosmetic concern. It can also be a sign of underlying health issue associated with obesity. Medication-induced humps. The following drugs contribute to weight gain and changes in fat distribution, including the development of your neck hump. Corticosteroids. These drugs are used to treat a wide range of conditions, including asthma, allergies, and autoimmune disorders. HIV medications. These drugs are used to treat HIV or AIDS. Hormonal therapies, for example, hormone replacement therapy for breast cancer. Antipsychotic medications. These drugs are used to treat the symptoms of schizophrenia and other psychotic disorders. Treatment for soft tissue-related humps. Weight loss. Reducing overall body fat can help decrease the size of the hump if it's an obesity-related hump. This involves adopting a healthy, balanced diet that is low in sugar and saturated fats and rich in fruits, vegetables, lean proteins, and whole grain. Review of your current medications. If the hump is caused by medications like corticosteroids, your healthcare provider can help to adjust the dosage or switch to a different medication that has fewer side effects related to fat distribution. Liposuction involves the surgical removal of fat from the hump area. It's a relatively straightforward procedure that can significantly reduce the size of the hump. I want you to avoid unnecessary cosmetic procedures such as cool sculpting, body contouring, and injectable treatments to dissolve your soft tissue-related hump. Find the cause of your hump first and address it. And who knows, maybe after the treatment, you will see significant improvement without the need for invasive intervention. Please don't self-diagnose your neck hump. You don't have enough experience. Consult your healthcare provider for an accurate diagnosis and appropriate treatment plan. Don't forget to share this information with your loved ones. Stay tuned.